So I'm one of the spine surgeons here at Midwest Orthopaedics at Rush. My area of focus is minimally invasive surgery, so basically outpatient spinal surgery. I've been here now for 15 years. I trained in Chicago, so I've been in Chicago for 21 years. Over the last, I would say, 12 or 13 years, I transitioned to microscopic or minimally invasive surgery. So kind of outpatient surgeries, things that normally were done in hospitals, focus on minimizing bleeding, minimizing narcotic need for surgery, and getting people home the same day. Sure, so it's kind of like where sports meets spine. So everyone can kind of think of an ACL repair, so arthroscopically done. So we actually use the same cameras, even smaller. And endoscopic means to put that camera into the spine. So we make a small little hole the size of a pen tip, and with that camera, we go in and do discectomy, shaving down the disc, cleaning out stenosis and bone spurs, and even doing fusions that way. So actually, I had a very large referral source from a physical therapist in Georgia who took care of almost all the PGA Tour players. So I would see a lot of those tour players. Most of them was non-operatively. In my own practice now, I would say about 40% of the population identifies as a golfer, whether it be recreationally. And then I see a lot of people who are kind of semi-pro. So the answer to that question is, yeah, surprisingly, there's a large number of people who identify themselves as golfers, recreationally or professionally. So a golf swing, when done well, has no impact on the spine. Unfortunately, very few of us have a normal or natural golf swing. So you can imagine the amount of force that's generated. So just the twisting of the back, the downward pressure from the arms coming through on the swing, and then not being able to, or inappropriately moving your hips, can lead to a lot of stress along that, the disc spaces in the lower back. Yeah, the most common is probably a flare-up of degenerative disc disease. So as we get a little bit older, the spine loses some of its flexibility. And the golf swing is a pretty unnatural swing with a lot of force placed onto the back. And so there's a lot of flare-ups with that. So people have a lot of back pain, and then as a result, sometimes they have a lot of leg pain. I think probably the biggest mistake that most people make is that they don't warm up. So even if you just do normal exercise, 5 minutes of a light cardio beforehand, some stretching, in particular your hamstrings, your hip flexors, your lower back, make a tremendous difference. But you see guys go out, or women go out onto the golf course, they pick 2 or 3 clubs up and they start swinging at it like they're, hacking down a tree, and then they feel like they're warmed up, and next thing you know, 2 or 3 holes into it, they're stiffening up and their back is hurting. For the most common procedure, like a discectomy, shaving down the disc, people are walking that same day within an hour or 2 after surgery. It's actually what we tell people to slow down the recovery because they feel so good, because they have a high risk of another disc herniation happening through that little hole where the first disc came out. So in general, I tell people swing sports after spine surgery you can start easing into at about 4 to 6 weeks after the procedure. You can do cardio and all the exercises beforehand, but kind of hold off on the swinging motion until about 4 to 6 weeks. Yeah, so we're actually looking at golf swings through a motion, through a motion sensor analysis. So we analyze people's swings before surgery, and then we analyze them afterwards, and then we look at how much their back pain, how much their leg pain, how much their nerve root compression affected their swing, their posture, their striking. And we've been putting together some data. It's kind of interesting. People are clearly affected. We're not looking for a perfect swing, but we're looking for a return to a normal swing. And it's amazing how much a reduction in pain can improve people's performance.